Good morning. I'm Lucy Beednell with the ARC of Northern Virginia. We are very excited to have Lisa Humes with us today to talk about a question that affects almost everybody with a developmental disability at some point or another, and that's how do we navigate that move from being a Medicaid-only user to a Medicaid and Medicare user? And how does all of that work? And what do we do when those kinds of things happen? And why do they happen? And the question we get sometimes is, can we stop this from happening? All kinds of things that we know families want to learn about. Lisa, we are so grateful to have you here. Anyone who has questions while we're doing this live, feel free to put them in the Q&A. If you scroll around your screen, you should see where it says Q&A and has some little talking bubbles, and we'll get to as many questions as we can today. Always, you're welcome to go to the arcofnova.org, and in the top right of the screen is a little orange box that says I need help. And if you click that and put in a question, it comes to me. Again, my name is Lucy, and I'm happy to help direct you to whatever you need in the future. So Lisa, please take it away. We are excited to hear from you today.
Thank you so much, Lucy. I appreciate the opportunity to come and be here with you all today. And hopefully you get that in presentation mode. There we go. I just wanted to explain a little bit about myself and how I work with clients and what my role is here as well. So first of all, thanks to the ARC of Northern Virginia for addressing this very important topic. And I appreciate the opportunity to be here. So today's topic, we'll talk about Medicare, Medicaid, and some of the dual special needs plans that are not everybody is eligible for, but some folks are, and how do those things coordinate? This is an educational presentation, and so I won't be talking about specific plans or products. If you do have questions about that, of course, I'm happy to talk to those or address any questions at the end, possibly, or in a one-to-one kind of situation. So let me explain a little bit about who I am. And sorry, I went a little bit too fast there. I'm an independent insurance agent. I have 11 years experience and a background in healthcare prior to that time. I help people with things like Medicare and Medicaid, with the dual eligible plans. I assist individuals on and off the marketplace exchange. I work with groups for employee benefits. I help folks with long-term care, insurance, life insurance, health insurance for folks who travel abroad, and a variety of other things. I do have licenses in about 12 different states. So I go from Florida all the way up to Pennsylvania on the East Coast. I add in Tennessee and Texas. I have options for different insurance companies or carriers because I can broker across different ones. And the important part to you, of course, is there's no charge for my services. If you sign up for a plan, that's how I get my compensation. So the real important thing is it doesn't add any extra cost. There's nothing extra, whether you get it through me, go online yourself, some 800 number, it's going to be the same product, same price tag associated with it. What you do have when you have a broker is somebody that you can form that relationship with, ask questions. They can hopefully help you through any issues or problems that you have when you're signing up, or claims issues, that kind of thing. So that's the role of the broker. My office is in Manassas. I live outside of Fairfax City, so I am a local person here to Northern Virginia. This is my contact information, and I'll stop for just a second if anybody cares to write down any of that information. I'll also put a slide at the end, again, with the same information, just so if you wish to capture it, that you can. Okay. That number is my cell phone number, the 703-307-0090. It's an easy way to catch me, or call or text. So let's start by just looking at a few key terms. First of all, what a beneficiary. You might hear this term, especially with Medicare. They ask the Medicare beneficiary. If you're writing down a signature, they ask for the beneficiary signature or something along those lines. And in life insurance, we often think of the beneficiary as the person who gets the money. So you can think of it in Medicare or Medicaid as a person who's receiving the benefit. So the beneficiary is the person who's holding the card holder, if you will. A premium is a fixed amount you might pay for coverage, especially for a plan And typically it's set up as a monthly amount if you have a premium. Deductible would be a fixed or a preset amount that you pay for services. So if you have a copay at the doctor's office, maybe $10 for primary care doctor, you pay a copay and you're done. You don't have to worry about any deductibles or any of that kind of thing. The deductible is that preset amount that you would pay 100% for your services before the insurance company starts to pay their portion. The copay kind of skirts around that. You'd pay that fixed price and not worry about the deductible. But if you have a co-insurance or a percentage that you have to pay for a service, generally speaking, you pay your deductible first and then the co-insurance starts to kick in. So just a few terms there. What about Medicare? Medicare eligibility typically is for the following folks. It is a federal program. It's through the federal government, began in 1965, and generally includes insurance for people who are 65 and older, or if you're under 65 with certain disabilities. So if you're under 65 and you've been on Social Security disability, typically for that 24 months, once you hit the 24-month mark, that's when Medicare starts. They will automatically send you out your Medicare card. So once that 24-month period is about to be up or your eligibility begins for Medicare. Folks that can start Medicare earlier are those who have end-stage renal disease or ALS. Also, you have to be a legal resident of the United States for 5 years or more. And we'll talk about the 4 parts of Medicare. Now, original Medicare is Part A and Part B. So that comes on the red, white, and blue card, government sponsored. Part A is for hospitalization, skilled nursing, hospice care, typically. Part B for doctor visits, lab, x-ray, physical therapy, and durable medical equipment like wheelchairs, walkers, CPAP machines. So A and B are generally considered original Medicare. We also have Medicare Advantage or Part C. Now, Part C and Part D are always administered through private insurance companies. Only A and B are through the government. So Medicare Advantage is Part C. It can include coverage for hospitalization and doctor visits. It can add in prescription drug coverage and some more things. We'll talk about that in a minute too. And prescription drugs, you can either get those separately, standalone coverage, or you can get it included as part of Medicare Advantage. Those are the 4 parts of Medicare. Of course, A and B are what comes on the red, white, and blue card, considered original Medicare. Okay. Be eligible for Part A. Generally, you have to have worked 40 quarters or 10 years full-time, qualify under a spousal benefit. But if you don't qualify by any of those means or under the Social Security disability, then you may have a premium for Part A that can be up to $505 per month. Typically, Medicare Part A does have some out-of-pocket costs. When you go into the hospital, you'd have a deductible of $1,632. And I'll just put out there that this is this year's number. These numbers can fluctuate and change year by year, but this is the deductible for 2024. And if you're in for extended stays, in addition to this deductible or the $1,632, you may have co-pays or co-insurance if you're in the hospital. Under skilled nursing or rehab, you have 100 days worth of coverage under original Medicare. Same with Medicare Advantage, it stops at 100 days. And there may be co-insurance and co-pays under that Part A service. Just a quick note that if you do run out of rehab time or the skilled nursing, if you go beyond the 100 days, it's considered long-term care, and the Medicare-based plans won't pay for that. That's when Medicaid can kick in for some coverage after that. Under the Part B, that one is Again, if all you have is original Medicare, you don't have any extra services, the premium would be $174.70 per month. It would come directly from the Social Security check. If for some reason, if you're 65, aging into Medicare, you don't get a Social Security check, they send you a bill for 3 months at a time. Now, under Part B, typically it covers medical services. It can cover some prevention as well. So Part B covers the testing, the doctor visit, the durable medical equipment for medical purposes. And you do have some out-of-pocket costs. So there's a deductible this year, it's $240. So you would pay 100% of the cost of your services until you got through the deductible. And then typically Medicare picks up 80%, leaving you with the 20%. The downside to both original Medicare A and B is that there's no limit or cap on what comes out of your pocket with Medicare. So that's why having some kind of backup or additional coverage makes sense for most people. Also, if you go to see a doctor that doesn't, or a provider that doesn't accept Medicare, they can charge an excess charge, and that could be an additional 15% over and above Medicare's reasonable and customary amount. Now, that doesn't apply in every state, but in the state of Virginia, it does. We already know that Medicare doesn't cover everything as far as the financial piece, but what else does it not cover? And that would be acupuncture and chiropractic. It doesn't cover nursing home care, custodial care, or long-term care are not covered by Medicare. It does not cover dental, hearing aids, or vision. It doesn't cover emergency medical transportation or emergency care outside of the United States. If you're in the US, it does, but original Medicare has no provisions for care outside of the US. And of course, original Medicare A and B do not cover prescriptions. So how do we get those prescriptions covered? You can do that either separately as a standalone plan, or you can get it included as part of Medicare Advantage. In order to qualify for a prescription drug plan, you at least have to have Medicare Part A or B. You don't have to have both, but you have to have at least one of those in order to be eligible for a standalone prescription plan. And there may be penalties if you enroll late. So this is a good place for me to also say that some folks have what's called a late enrollment penalty, or LEP, and you can have that for both Medicare Part B and or Part D. If you go without the coverage when you're first eligible to be enrolled, and that doesn't matter if you're under 65 or over 65, once you're first eligible and you're not enrolled in a plan with Medicare, it's a Medicare-based plan, or at least as good as, so if you have employer coverage, that also works. But they want you to be enrolled in some kind of coverage. If you don't, when it's time for you to come back and enroll into either Part B or D, then there's a late enrollment penalty, and many of these penalties will stay with you for the rest of your lifetime. So important to get that coverage. Check out, make sure that you have the coverage that's considered creditable by Medicare. One of the things that is not creditable coverage would be COBRA coverage. So important for you to, maybe important for you to know that. Additional prescription information about Part B plans, you can purchase it standalone or with Medicare Advantage. We already talked about that. There may be deductibles, and each of the plans has its own list of drugs that are covered, or a formulary. Typically, every Medicare-based plan has at least 5 tiers of medications, tier 1 being the cheapest preferred generics, all the way up to the specialty drugs. They always want you to start on the lower level, work your way up if you have to, and that's called step therapy. Some medications may need to be approved ahead of time or prior authorized to make sure that you're taking it for the right reason that it was FDA approved for. Some medications may have limits or quantity limits on how much you can get for a 30 or 90-day supply. Things like opioids, pain management, and controlled substances might be those that apply to those limits on how much you can get. And then, of course, there may be premiums based upon income. We already talked about the fact that you might have an extra penalty or a late enrollment penalty if you come in late. There's an additional place where they can charge more, and that would be with the income. So these premiums that are based on income, if you're considered a high wage income earner as a single individual, this year the amount is $103,000. As a couple, it's $206,000, and they check the IRS tax return on that one. If you are over those limits, it's a sliding scale on how much more you will pay for both Part B and D. And of course, if you have any questions about that one, I'm happy to answer those as a one-off. I don't think that will apply to very many people on the call today. Now, there are some things in prescription drug plans. They all have these different stages or phases of coverage. So every plan might have, it could have a deductible. It can be anywhere from $0 to $545 this year. So it depends upon the plan that you have. It's called initial coverage stage, coverage gap or the donut hole, and the catastrophic stage. So let's talk a little bit more about those. If you have, let's see, the initial coverage stage, we'll just go right into that one. So this is a little slide that's set up. The first thing, if you had a deductible that applied to your medications, you might have to pay 100% of the cost of the medication until you get through the deductible. Once you're on the other side of the deductible, then you start in that initial coverage stage or your copay phase. So you're paying a copay or a co-insurance until anything that you've paid out of your pocket, that includes the deductible, it includes your copays and co-insurance. It also includes what the prescription plan or the insurance carrier, what they paid for your medications. If those three things add up to $5,030, then you go into the next stage called the coverage gap or donut hole. Now, instead of a copay, you'll be paying a percentage of 25% for typically all of your medication until such a time or if you hit this threshold of $8,000. That true out-of-pocket cost threshold is not just based on what comes from your pocket, but also what the drug manufacturer discounts, etc. If that calculation, however, adds up to $8,000, then you go into the last stage called catastrophic, and instead of paying a copay, it's 0% for the rest of the year. Now, every January, plans start all over and start back at the beginning, and we work our way through these different phases. Now, in 2025, there will be some big changes with prescription drug coverage coming. They are to have a cap of $2,000 maximum for all medications that you pick up, and that is supposed to be spread across the 12-month period. We have yet to see, of course, what that's going to look like, but more information to come on that for 2025. For 2024, this is what we have to contend with. Now, if you have additional coverage, that's going to take care of a lot of these things that we see here, and we'll change the rules. But if you don't have anything except original Medicare, this is what it looks like when you enroll into a prescription drug plan. Now, you can also get what's called a Medicare supplemental or a Medigap plan, sometimes called a secondary plan. Always sold through private insurance companies. It works with original Medicare Parts A and B, helps to cover those gaps. It helps to cover the gaps like the 20% that Medicare doesn't cover, the 1632 that Medicare doesn't cover when you go into the hospital. It also doesn't include prescriptions because all it's doing is working with Medicare Part A and B. It doesn't include prescription plans, so you can buy that separately. Now, the downside to Medicare supplemental insurance is that many folks on the call today will not be eligible for that because there aren't very many supplements available to those who are under 65 in the state of Virginia. There's one plan Plan A, that you can enroll in if you're under 65. The downside is it's very expensive and it is not full coverage. So in rare instances, does it make sense? Most people, it doesn't make sense to enroll into Medicare supplemental coverage until or if you're 65. So you can join in Medicare Advantage plans, but not the supplemental coverage when you're under 65 on Medicare. Medicare supplementals, this is just finishing out this slide. I don't want to spend a lot of time on it. This you'll see in any Medicare-based information about the different plans available. The only one that's available under 65 is this Plan A. The rest of them, you have to be at least 65 or older. So Medicare Advantage is available to anyone on Medicare, no matter what your age. What happens with that is it takes over the services that original Medicare normally provides. So it takes over the hospitalization, it takes over the doctor visits and the testing and the durable medical equipment. It can add in prescription drug coverage, and it can also add some additional things like dental, vision, hearing, etc. So Medicare Advantage can take those things in. Because it's taking over for original Medicare and you're partnering with a private insurance company, you want to make sure that your providers are in the network. Your medications are on the formulary and those kinds of things to make sure you know what that coverage is going to look like. And of course, that's something that I generally do with my clients, is to verify coverage with the providers they're currently using, and whether that's home health care or physical therapy or doctors, you know, all those should be in the network with any plan that you're looking at. And of course, they are always offered through private insurance companies. How do you qualify for Medicare Advantage? You have to be enrolled in both Part A and B, not or, but both. And then, of course, you have to live in the service area. Many of these plans are more local in nature, so there are networks that you want to be looking at. And you may have a plan that's available in Arlington, Fairfax, Loudoun, and Prince William, but it's not offered in Fauquier County or Orange County or Culpeper. So different areas of the state as well as the country have different plans to offer you. You have to purchase a plan where you are on file with Social Security. So that's important to know. Whatever zip code you live in, as far as Social Security is concerned, that's where you have to buy your plan. This one is just a slide comparing Medicare supplemental versus Medicare Advantage. Again, I don't want to spend a lot of time on that one because most folks aren't eligible for the supplemental at this time. Now you can get some additional assistance, of course, and many people here do have those extra options. So that would include Medicaid, which can help to cover some additional costs that Medicare doesn't, like the co-pays, the deductibles, things of that nature, and they may provide additional benefits. So you might get the phone from them or some transportation or something like that from Medicaid. There's also Medicare savings programs, and those typically are coordinated efforts through the government and the state. It's kind of a partial Medicaid, and it can help to cover premiums for Part A and B. It can also help with some deductibles and co-pays depending upon which of the savings programs you're eligible for. And lastly, there's the Extra Help Program, or Low Income Subsidy, LIS as it's sometimes called. And it helps to cover not only the cost of prescription drugs when you go to pick them up, but it also helps to cover the cost of a plan that provides those medications. So Extra Help Program also additionally provides a reduction in cost. Sometimes it helps to reduce or eliminate the premium, and some deductibles and co-insurance, making the medications low cost and much more affordable. So there may be some additional programs than those that I've listed here, but these are the three major ones. And I'm going to kind of dig in a little more detail, but I'm going to start from the bottom up. So I'm going to start with the Extra Help Program or Low Income Subsidy administered through Social Security. If you go to ssa.gov and just search in the bar, Extra Help or LIS or any of those things, it should bring up some information and the application if you haven't already done it or you think you're eligible. The purpose, again, is just to help to reduce the cost of medication when you go pick it up at the pharmacy, but it also adds in some extra benefits. So those extra benefits provide you with a special enrollment period where you can change or add a prescription drug plan or even Medicare Advantage plan throughout the year. In the first quarter, you can make a one-time change. Same thing, second quarter and third quarter, you get one option. Once you've utilized that option, it's done for that quarter and you don't have another chance to change till the following quarter. If you try to make a change in the fourth quarter, it's always going to go in with the general or the annual enrollment period, and then that plan would start in January. An additional benefit for low-income subsidy is that it wipes out any late enrollment penalties that you might have. So if you've had a penalty for prescription drug coverage, it will just be done away with and you won't see that as a cost to you any longer with the Extra Help Program. Also, eligibility is based on income and assets. It's a little higher than it is for Medicaid, but you still have to qualify for it. And you can qualify again by applying at Social Security. The income level can be as high as the 1882 or for a single person for 2555 for a couple on a monthly basis for income, and that's before anything is taken out. On the asset level, the numbers here, 17,220 for a single person, 34,360 for a couple. And those numbers are based on anything that you have like income, sorry, not income, but your assets in the bank. If you have any CDs, IRAs, investments, any of those things will count towards that number. The things that do not count towards that number would be your house, a car, a final expense policy for life insurance. Those things do not count against those asset numbers because you have to have those are essential to living. Now, if you had two cars, if you have a second home or something like that, definitely that would count towards your asset number. So if you think you're eligible for that program or you know somebody who is, qualifying at Social Security is an important piece. However, you don't have to qualify. It's an automatic enrollment. If you're in Medicaid, you will automatically be enrolled in the Extra Help Program. So that comes along with that. But if you're not eligible for Medicaid, your income levels and assets meet the qualifications, you're still eligible for the Extra Help Program. So just to say it again, if you're in Medicaid, you already have LIS, you don't have to apply separately. If you did not qualify for Medicaid, you may still be eligible for the LIS program. Then there's the Medicare savings plans, and Medicare savings plans are basically a partial Medicaid. And there are several different levels of that. So QMB, or the Qualified Medicare Beneficiary, where it will help pay for your premiums for Part A and B. It can also pay for some of the deductibles and co-insurance for your services, for your medical services. SLMB, or Specified Low-Income Medicare Beneficiary, helps to pay for Part B premiums, just like the qualified individual, or the QI helps to pay for the Part B premiums. And please don't ask me to separate out what the difference is between SLMB and QI, because I'm not a Medicaid expert, but I can just tell you that those two things are paid for there. The QDWI, or Qualified Disabled Working Individual, helps to pay for Part A premiums. So those are what's considered partial Medicaid. If we look at the Medicaid programs. Now we had QMB on the last slide, but now we have QMB plus. So it's qualified Medicare beneficiary plus because it adds in full Medicaid. So it does the same things, but adds Medicaid. SLMB plus does the same thing, plus adds full Medicaid. And we have the FBDE or full benefit dual eligible, which includes services beyond Medicare. It has full Medicaid. So all of the plans on this slide add in those extra things like the phone and whatever else is included with your MCO or managed care organization. And we'll look at that in just a second as well. But all these are for full Medicaid programs. Now, the dual special needs plans for Medicare Advantage, D-SNP, there's a lot of names that they use for those. Those plans, you have to have, you can be qualified by having Medicare Part A and B, and Medicaid with QMB plus, SLMB plus, and FBDE. So these three programs will have what's called an MCO, or managed care organization, which means it's an insurance company that's actually administering the Medicaid, and that insurance carrier may offer you certain benefits. Different carriers offer different benefits along with the Medicaid. Then we have insurance companies that offer these Medicare Advantage plans that help with the Medicare portion of the services. Also, there are some insurance companies that have additional higher benefit plans for QMB, not the QMB plus, but just regular QMB or qualified Medicare beneficiary. And some of them offer additional benefit plans for folks who have extra help or low income subsidy. So different plans available in different areas and with different insurance companies. This is just a chart of the managed care organizations. So you have 5 of them: Aetna, Anthem, Molina, Optima, and United Healthcare. Gives their information here for all of them and the extra benefits that they all include. I'm sorry, I know this is a very busy slide. I didn't blow it up or specify each one of them, but if you go to Google and just put in Cardinal Care Health Plan Comparison Chart, it will pop right up and you can download this and take a look at it for yourself. Basically, for the managed care organizations, Cardinal Care, this is Medicaid through the state, and that is the one that will offer you things like the phone. They might have some additional vision or hearing benefits and things like that. So you can take a look at which one of those you have. Now, of course, with the dual plans, the dual eligible plans, those too are offered through private insurance companies. And if you use the same company for your Medicare and Medicaid, or for your MCO and your Medicare coverage, they may even offer some additional bumps in benefits. So just wanted to show you this as the 5 different companies that offer Medicaid in the state of Virginia. So with the D-SNP plan, the dual eligible plan or Medicare Advantage, you may have extra benefits on top of both of those plans that are not typically given to you with Medicare or Medicaid. So they offer some additional things like over-the-counter benefits, additional dental, vision, hearing, maybe some assistance with groceries or utilities and things of that nature. So there may be some extra things that come along with the dual plans. Some companies, not all, offer some things that might help out with pet supplies, rent or mortgage assistance, additional transportation, and most of the dual special needs plans also offer some over-the-counter assistance, things like cold and cough syrup, vitamins, supplements, adult diapers. There's a variety of different things that you might get there. Maybe some assistance with utility and healthy foods. So it depends on the plan, depends on the company that you're using, and it can also depend on the area in which you live. Some places do have more benefits than others. So if you think of it, the dual special needs plans, they kind of work like a layer cake. Medicare is the one that is the cake in all of this because it's the basis, it's the starter, it starts the benefit. Medicaid might be that frosting that comes and fills in the gaps, like the 20% that Medicare doesn't pick up, or the 1632 when you go into the hospital. So Medicaid fills in, there's the frosting in this cake. And the D-SNP plan or the dual special needs plans are kind of like sprinkles because they add in some extra things, additional dental and vision, over-the-counter and utility health, that kind of stuff. So you have to have all three to make the cake stick together, because without the cake, the frosting doesn't hold, and without the frosting, the sprinkles fall off. So all three of those things have to be there in order to get those benefits. When you're coordinating plan benefits and you have a dual special needs plan, let's say you're eligible for one of those, you're ready to sign up, the things that you have to know are that dual special needs plan now becomes your primary insurance. So that's the one, that's the card you're going to pull out first. You don't have to take your Medicare card with you. You can actually leave that one at home because the Medicare card is no longer the one that's going to be the primary plan. So the dual special needs plan, that is the one that's primary. Medicaid will become your backup or your secondary, essentially, because it helps to fill in if that dual special needs plan provider isn't in the network and they take Medicaid, then Medicaid's going to come in and help to pay for the service. So those two things do work well together. What doesn't work very well is a third-party insurance. When you have TRICARE or employer-based plans, they don't coordinate very well because, again, the dual plan is primary. Or if you don't have a dual plan and you just have original Medicare becomes your primary. Either way, the services have to be approved by them. If it's not an approved service, it won't go down to Medicaid or get filtered through to that third-party insurance. So some of those things are very difficult to coordinate, and you have to be well aware of that before signing up for any plan. So these are good plans to help with those extra benefits, but you just have to know that they are going to be the primary insurance, and you want to be very careful about your networks. So just some things there that are so important to take into consideration. Now, I have some additional resources here for Medicare, for Social Security and Medicaid. I'll leave this up for a minute just to help for anybody who wants to either write that down or copy the slide or anything. But those are some resource pieces for you. Lucy, how are we doing on questions? Anything that I could answer for anybody?
I want to encourage people to keep putting them in, but we do have a few to get started here.
Okay.
The first one was, is there an easy way to check on the status of, in this case, Medicaid renewal applications? So I'm trying to keep these dual eligibilities that I have. How do I make sure that that's going through? And I'll say this type of question is something we hear a lot where there's not always a lot of communication back from that Department of Social Services worker.
You're absolutely correct. And I'm sorry that there's not a real good, clear-cut answer on that one. But with the redetermination efforts after COVID ended, so as of April 1st last year to April 1st of this year, really important that you're keeping a close eye on the Medicaid piece, because everybody had to be redetermined to make sure they were still eligible. You can imagine that once COVID hit, people lost their jobs, they became eligible for Medicaid. Now that it's things have reopened, many people back to work. Those folks that went back to work should no longer be eligible for Medicaid and should be taken off the system. But Virginia had 2.2 million, I think, that they had to redetermine. They're busy. And they're trying to still weed their way through that. They have another month or more to be able to finish up this whole process. They're sending letters out to everybody, but you can also imagine that folks on Medicaid might not have stable home situations, and if they move and they sent a letter to the wrong address, you didn't get the letter, you only have 30 days to respond to that letter to make sure that you are still eligible, you complete the new application. If you didn't do it, you're going to lose Medicaid. So very important to still communicate. And the best way I can say is if you have a case manager assigned, to try to work with that person, or you can call the general number for Medicaid and try to get through. Lucy, do you have any better ideas?
No, that's it. You know, we often advise people when they're calling Department of Family Services to ask to speak to a supervisor. If the person has Medicaid because the person has a waiver, making sure that you're talking to someone in the long-term care division. Long-term care essentially means waiver, and they look at waiver or Medicaid applications a bit differently. So making sure that you're in contact with those folks, following up. It can take a lot of pushes. And we actually had a parent ask a related question saying that when they got their renewal this year, they didn't hear anything differently from Medicaid or Medicare, but all of a sudden they started having copays where before their copay had been $0. And that's not a question I get very often, actually. Do you have any ideas about that, Lisa?
Yes, I've seen people change from one level of Medicaid to another, and I don't know if it was because of the changes with Social Security, the increases in Social Security that maybe didn't quite match up with the new income levels for 2024, but I have seen people get changed from one level of Medicaid to another, which then they drop their copay assistance and they're going back to copays again. So it's you know, if you have questions about that, I would go back to Medicaid and ask them what changed with their level of assistance, because you didn't have copays. Now you do. You may have gotten changed from, I don't know, SLMB plus or QMB plus to QMB, or something along those lines. If you had one of the pluses, but they dropped the plus and now you're just back at the regular level, it might be paying your Medicare premiums, but not the co-pays at the doctor's office.
Right. Oh, this is a great question. When we talk about assets being considered for someone's eligibility for these programs, a parent asked if an ABLE account counts as an asset. And for folks who don't know, ABLE accounts and special needs trusts are ways for people with disabilities to save or inherit money, generally without being counted as assets for public benefits.
Correct. They're not supposed to be counted in there. That's the kind of the point to having those things. So those are not supposed to be included, is my understanding.
I will put a little reminder in here that even though that's the case, during renewals, it's very common for families to be asked for a copy of a special needs trust or ABLE account agreement and or a recent statement. And that's for the people processing the application to make sure the special needs trust or ABLE account was written correctly and is being used correctly and continues to be an uncountable asset. So don't worry if they ask for those kinds of documents. That's very normal, and it's just part of their check to make sure that account is being used correctly.
That's
Right.
right.
There was another question here about how does mental health fit into this puzzle? And I'm guessing as a type of disability and in terms of eligibility.
Well, in terms of eligibility, it would be, you know, a Medicaid. That would come into whether to play, I guess, whether or not whether you're able to work and that sort of thing. So that eligibility piece, maybe you could speak to that one a little bit better. But as far as what's services are available, mental health is covered under Medicare. So there are counseling services, admissions, etc., that do count for mental health services. And so Medicare Advantage also has provisions for those things. Anything that is a service under Medicare Part A or B has to be included as a service under the Medicare Advantage or dual special needs plans as well. Does that help?
Yeah, I'll say something that we get sometimes that's tricky is though a lot of the ARC's work is with people with developmental disabilities who often move to SSDI, Social Security benefits, and Medicare based upon their parents' work record. If someone has a mental health disability that onset after the developmental period, let's say we didn't see those mental health symptoms until the person was maybe 24 or 25 years old, then that's not considered by Social Security to be a disabled adult child, meaning that person doesn't get SSDI and Medicare as quickly as people with developmental disabilities would. And it's something to be aware of. Those folks often have to wait until age 65. You know, they may get Medicaid based upon their mental health disability being really significant. But if they didn't work a lot, and they weren't disabled as children, then they can't get Social Security benefits and then SSDI on either their own work record or their parents. And that's something more about eligibility than coverage that I think is worth noting.
But
All
that might
right.
change, right, Lucy, if there were some other physical condition that came along with that.
Yeah, and so if something did onset in childhood, maybe it's not the mental health disability that makes them count through Social Security, someone who was disabled as a child. Maybe it's something else and they have mental health needs in addition to that. But if mental health, you're right, is the only disability, then things are a little different. Oh, we got a good question based upon something about the card you mentioned for dual special needs eligibles. So a family saying that they do have a dual special needs plan, but they aren't quite sure what the card you referred to is. They're saying, is that the MCO card for Aetna, meaning they only need to show that Aetna card and not their Medicare card when they go see medical practitioners?
So if you have a dual special needs card, you get a member ID card, and that it will have the name of the plan on there as well as the insurance company, of course. That card would be your primary insurance card, and then the Cardinal Care card with the MCO on it. If they had Aetna as their MCO, that would become their secondary card. So the primary insurance would be the dual special needs plan card, and the MCO card secondary.
Oh, another good question that we do get a fair amount is the term cardinal care used for all Medicaid MCOs. I see that Aetna, yeah, now uses it.
Yes. It
That
was
was a move
changed
that took place just last year, right?
January 2024. Yes, they changed from Commonwealth Coordinated Care to Cardinal Care.
Right. I have a son diagnosed with autism. Medicaid said he wasn't eligible for care anymore after the family had another child. So how could we get eligible for Medicaid again?
Oh,
It's tricky to me because generally speaking, having another child would of course increase the household size, which
mhm.
means the household can earn more money and still be eligible for Medicaids. And this seems like the reverse situation. So it shouldn't just be that having another child prevented the first child with autism from losing coverage, but if there was a salary increase at the same time for that family, it may have adjusted the calculations so that family going from a family of 3 to family of 4, if salaries in the whole family went up enough, that perhaps that child lost eligibility, but it shouldn't be due to the birth of a sibling, right, Lisa, unless I'm missing something?
No, I've not heard that scenario either.
I will say at the Arc of Northern Virginia, we talk a lot about the Medicaid waiver program, which provides long-term care, you know, caregivers in your home. And that program is valuable in part because so many folks need that care, but also because it's a back door around that whole family Medicaid eligibility. So let's say in the same case, we had a young child with autism. If that child had a Medicaid waiver, then that child still gets Medicaid regardless of the whole family's income. They're only looking at the child's income, which is usually zero for children. And I'm happy to send out some information about that Medicaid waiver program when we follow up from today.
That's a very important one.
Yeah, okay. So oh, great question. When can we pick our dual special needs program? My husband will turn 65 next year. They already have TRICARE. And our adult son with disabilities will be on SSDI for 2 years before the husband's birthday. So already we've started that 24-month clock from when someone with a disability gets SSDI. 24 months later, they get Medicare. So when in that scheme can we pick our dual special needs plan?
As soon as you get the Medicare card, that would be the time to make contact and take a look at what plans are available for your son. Because as soon as Medicare starts, if, let's say the husband's birthday is July, but Medicare actually starts in April, then you should have the Medicare card by January or so for Medicare to begin in April. You can make an application anytime during that time frame for the plan to start in April, right alongside Medicare. So it's based on when Medicare starts, Part A and B.
This is a really closely related question, but I want to be super clear in answering it. So if we have a family where parent is retiring very soon, they're turning 65, so we'll lose that employer-sponsored plan that's coming into the family, but the family has now adult children who've been disabled since birth. Those adult children, though disabled since birth, have been working enough to receive SSDI on their own work history, not just on parents. They've both had a disability that prevented them from working a lot, but have been able to work. And so the family here is clarifying, since their child just started receiving SSDI, will they get that Medicare 24 months after they receive SSDI on their own work history, or is it going to be tied to the parent retiring?
It should be tied to the child's SSDI. And do keep in mind that sometimes the SSDI can be backdated. So for example, let's say I had an accident that disabled me. It took me a year and a half to get the Social Security disability. And if Social Security disability backdates my eligibility, the 24-month time clock starts when at that backdated time frame. So if it were 18 months previously, that would mean that I can get Medicare in 6 months, because I don't have to wait for 24 months from present day and the 24 months from today, but it's 24 months from when they backdated my first eligibility.
That's it. So it should be 24 months from the start of SSDI eligibility if you didn't start getting SSDI right then. If it's on your own work history, if you're on your parents' work history, it's that eligibility date that should be the driver of when Medicare ultimately comes.
Right, that's the trigger.
So my son is a new Medicare member with Medicaid as a secondary plan, and they say he isn't eligible for these Advantage plans, but he seems like a dual special needs eligible. How do I navigate this?
So I have special tools that I have through my broker resources through different insurance companies that I go in and check to see what plans folks might be eligible for, because again, it depends on your level of Medicaid. And as you just mentioned, there are some levels that aren't eligible for some of these plans, and they're not always eligible in every area or every county. So if you had only LIS or extra help, or you only had QMB, not every plan is available in every county. So if it's a QMB individual, for example, there are limited amount of plans that are available. And if there wasn't one available in the county in which you reside, then that would be why he's not eligible. However, you can check with Medicare, or, you can call me and I'd be happy to check.
All right, thank you for that offer. What happens if you're a dual eligible but don't enroll in a dual eligible program?
Basically, you're just missing out on some of those extra benefits. You don't have to enroll in one of those, but sometimes the added benefits do make it worth a while. And it's very dependent upon your situation, both medically and where you live. If you're in a situation where you're living in your parents' home and they're taking care of all the financial piece, then maybe that utility help and some of those extra benefits aren't as important. However, if you're out there on your own, having some of those extra assistance programs like help with utilities or gas or food may be important to you. So it depends on your situation. And also networks of the providers that you use. There's a variety of different reasons. Everybody's reason to enroll might be slightly different. There's no one size fits all, but you don't have to enroll if you don't want to.
Great one. Okay, so let's see. I have a parent of a 23-year-old son who already has SSI and just passed the 24 mark with getting SSDI, and as a result got that Medicare Part A and B card in the mail. And the question here was, does this son still automatically get Medicaid? And I'll say in Virginia, if you're approved for SSI, you're automatically eligible for Medicaid, but you still have to fill out the paperwork to get it. So if you haven't yet done that, I would say that's a good idea to do. At Common Help is Virginia's website. It's what it's called for applying for that Medicaid. I would advise phone calling to apply. I think it's a little more seamless. Or if your child already has Medicaid, then they should be able to keep it along with that new Medicare, and then would become a dual special needs eligible person possibly here, right, Lisa?
That's right.
Okay. Oh, are beneficiaries notified when they're getting close to that 24-month period on SSDI that gets them Medicare so that they can start looking at these plans? Is there any kind of advance heads up?
You're typically the only advance heads up is that you receive the Medicare card in the mail. I haven't seen them do any big notifications saying, oh, it's coming. Usually people will get this Medicare card and will go, why did I get this? I didn't know I was going to be eligible for this, but it will often come in the mail 2 to 3 months in advance. But look at the card itself. On Part A and Part B, it gives your effective date. So it tells you when it starts. If it begins next month, then you have until the beginning of the month. If you wanted to enroll in a plan that starts that day, then you want to make sure to enroll this month. But it might not be starting until, here we are at March, it could be May 1st before it starts. So it's just a notification by getting your Medicare card typically, or knowing when the SSDI started so that you can kind of figure that time clock yourself. Now, if the SSDI event, let's say it was based on an accident, an illness, something that began in the middle of the month, it does have to be 24 full months before you're eligible. So you can sometimes figure out when it might be coming.
Right. So I think we can squeak in one final question before our time ends today. And let's see here, one that we get a lot. Okay, so are minors with DD waiver, so in this case, a child that has Medicaid, are they ever on Medicare too? Maybe they had a parent that died, even though that child is still a minor and that parent's been dead for 24 months, which would have moved them to SSDI. Is it possible for a child to ever get Medicare?
I don't know that I've ever seen minors in Medicare. Typically it's Medicaid. What's your experience then, Lucy?
No, I've not seen it in the past, but I can't swear that it's not possible, right? I mean, I know, like you, most of these kinds of things based upon what I've seen. I would say once this child reaches age 18 and they're applying for Social Security benefits on their own disability record, not just being a minor child, if it hadn't happened before, that's when that clock should start ticking, if not before. And I would say, reaching out to your Social Security office, if you're ever talking to them about this child's benefits, they should be able to answer that question, and possibly your child's long-term care eligibility worker for Medicaid can answer that question too. And those people are both nice because they can look at your child's specific record and give you very concrete answers as opposed to general answers we can give with little information. Lisa, did you have any closing words or thoughts for today?
I just want to thank everybody that took time out of their day to come and join us. That was very nice, and so pleased with the amount of people that had interest. So thank you very much. I appreciate it.
You for being here. If you're watching this in hindsight, you're always welcome to reach out at thearcofnova.org. Click that orange rectangle that says I need help in the right corner of the screen to send us questions. And Lisa has been kind enough to provide her contact information here, who's just a tremendous resource. Thank you all so much for joining us and have a great day.
Thank you.